So today I want to talk about some exercises you can do at home to help prevent and treat certain injuries you see in the elbow, wrist, and hand that you see in a lot of rock climbers. Remember, before we do anything, we always want to warm our hands up, warm our joints up. So before you go climbing, remember to get the motion going through the joints. You can do some finger kind of extensions here, curl them up, flex them in. You can do thumb to each finger and really work mobility there. You can really extend it out where you touch, extend all the way open, touch, extend open, and get the hand going so it's ready to go climbing. Remember, if you can prevent an injury, it's going to save you a lot of time rather than having to treat and rehab an injury. The first exercise I want to talk about is some grip forearm strengthening. So today I'm going to use a tennis ball. You can just grip it and relax, or you can grip and hold 1, 2, 3, 4, 5, or you can take it into the ends of your fingers and work on strengthening each finger joint separately this way. If the tennis ball is a little too tough and it's hard and it's too much resistance for you to grip, try something a little bit easier. You can go get putty or Play-Doh, and you can do that same type of thing. Even a bunch of rolled up, balled up paper or a towel, something like that will help you get some resistance to help strengthen your grip. The next one I want to talk about, some basic wrist strengthening exercises. So we have wrist curls, where you curl the weight up, wrist extensions, where you extend the wrist back. You have some ulnar deviation, where I support my arm here, bring the weight down, bring it back up. You can even do some radial deviation, where you come back and forward. You can do it all in one nice controlled motion. If you don't want to use a little weight like this, you can get a hammer. It works really well. It gives you that grip and nice resistance at the end, so you can get a little bit more benefit from it. You also have pronation supination, starting with the weight in my hand just like it was for the hammer exercise. Rotate the weight to one side, bring it back to the other. Notice I'm kind of stabilizing my elbow here, so I'm not getting a lot of body motion, a lot of shoulder motion. It's one way to really isolate the muscles you're trying to focus on working. We also have eccentric exercises which help treat a lot of different tendinopathies, tendinitis, like that lateral epicondylitis that you see. Sometimes you have the medial epicondylitis down at the bottom of the elbow there. With these exercises, what you're trying to do is you're lengthening the muscle, helping to repair the tendon, helping build a little strength that way. So what I'm going to do is I'm going to use my left hand to guide the right hand up into that wrist extension position and slowly lower the weight down. This works really well if you want to put it up on your knee so you have a little bit more stability. So I'm going to help up, curl the weight down. You can do the same thing in the opposite direction for the medial epicondylitis. So you raise the hand up, slowly lengthen that muscle back out. Raise it up, slowly lower out. One other one, I have a TheraBand here. You can use a rubber band, something to wrap around your fingers. You can do it without anything if this resistance is too much. All you're looking to do is get your fingers inside the band and then extend out and try and open your hand against the resistance. Bring them in. So the starting position kind of looks like this. Extend open, bring it back in. Extend open, bring it back in. So those are some of the basic strengthening exercises we use. We can also do some stretches to kind of open up the forearm a little bit, kind of bringing the hand and the palm back, stretching out that bottom part of your forearm there. You can do it in this direction as well. You can also pull the wrist down, stretch out that top, the extensor mass on the top of your forearm. Really get a good stretch there. When you're doing your stretches, you want to remember trying to hold them for about 30 seconds to a minute if you can. Give yourself a little break. Repeat that a few